Are you confused about what Avaps is and when you should be reaching for it? The idea behind Avaps, or average volume assured pressure support, is that it ensures the patient gets a set volume that you determine. To that end, we're setting both an inspiratory and expiratory positive airway pressure, but we're going to be doing this a little bit differently than what we do in BPAP. Just like with BPAP, we're going to set an expiratory positive airway pressure, or an EPAP. But instead of setting one inspiratory positive airway pressure, or IPAP, we're actually going to set two. So that might look like something like 10 millimeters of mercury for your low IPAP and 20 millimeters of mercury for your high IPAP. What Avaps does is ensure that the machine delivers the set volume you want by varying the pressure between those two IPAP numbers, depending on what it determines the patient needs in terms of support. One great place to use Avaps is in the patient with hypercarbic or type 2 respiratory failure, where you want to blow off more CO2. There's no real data showing that Avaps is superior to BPAP, but I do find more and more folks reaching for it. What I typically do is start with BPAP, and if I find that I'm not getting to where I want to, or the patient isn't comfortable, I'll switch to Avaps. But most of the time, I'm doing this in conjunction with the respiratory therapist because they have a great gestalt over which patients might respond better to Avaps and which might respond better to BPAP. So there's Avaps in a nutshell. If you haven't been using this, try it out, see what you think.